Thank you so much, sir. Thanks a lot for your wonderful words. So, with your permission, we will go to another honorable doctor, one of our fantastic scientific doctor, that she's associate professor and chair of oral and maxillofacial medicine in Mashhad Dentistry School, head of Shahab Oral Medicine and Special Care Dentistry Clinic, Dr. Pegah Mosannen Mozaffari. Over to you, dear doctor. Welcome.
Hi, dear Dr. Mostafi. Happy to be in this meeting. Can I share my screen for beginning of presentation?
Sure. Would you please share the screen, please? Thank you. Welcome, doctor. خوش آمدید.
Thank you so much. Hello everybody, and hello India. I have masala tea here for celebrating this day in India. I will drink it after my lecture. It's my pleasure to have the chance to present my lecture to you. Before I start my lecture, I would like to express my thanks to Lilly Excellence Center, and my special thanks goes to Dr. Mostafi. Before discussing my lecture, let me introduce myself. I'm Pegah Mosannen Mozaffari, Associate Professor of Oral and Maxillofacial Medicine and Head of Shahab Dental Clinic, which is located in Mashhad. As you see in the running title, my lecture is about how a dentist can help a pregnant woman. The first topic to cover is whether going to a dentist is necessary before pregnancy or not. The answer is yes. All dental and oral problems must be resolved before pregnancy. If you fail to treat these threats, you are likely to experience pain, infection, stress, and you may even have to resort to use drugs during pregnancy. As we know, the first principle of medicine is a sentence made by Hippocrates, which is premium non nocere, which means first, do not harm. When we are engaged in treatment of a pregnant woman, we actually dealing with two persons, the woman and the fetus, so the risk doubles. And we should balance the risk against the benefits of the treatment. You can see a pregnant woman here whose tooth was extracted as a consequence of pain and infection. You can see me extracting the teeth, and you know that extraction and surgery puts the pregnant woman at the risk of clot formation and the consequences. So she would have been better off if she had performed dental checkup before pregnancy. Many changes take place in pregnancy. For example, cardiovascular changes, respiratory changes, and oral changes. Here you can see me treating a pregnant woman in a stand-up position due to respiratory problems of the woman. A pregnant woman cannot tolerate supine position due to respiratory problems. So sometimes it would be difficult to treat the patient in pregnancy. Let's go around high-risk pregnancies. Women who have abdominal pain, spotting, miscarriage, stillbirth, eclampsia, and preeclampsia, and medical conditions listed here, or those who rent their wombs, undergone IVF, and have difficult pregnancies are high-risk patients. It's wise for such patients to seek consultation before dental appointments. Here you can see a picture showing preeclampsia and eclampsia signs, which is one of the most serious complications of pregnancy. There's a common myth that goes dental radiographs are harmful and must be avoided during pregnancy. But don't worry. Nowadays, thanks to digital radiographs and which have reduced exposure to less than 0.03 seconds, a very negligible risk has become possible. And by lead aprons and thyroid shields, you can ensure a safe imaging experience. One interesting thing is that if you have two periapical films, you will get much less exposure, even about 700 times less exposure than if you have one day in the US, because we have something called environmental exposure. And if you take a trip to Ramsar, which is a coastal beach in the north of Iran, you will get much more exposure. So don't stress off. However, we must avoid routine radiographs and should use them wisely and selectively. Another concern is about drug prescription during pregnancy. When it comes to pregnancy, we have 5 categories from A to X, and most dental drugs are placed in category B and C and can be used safely. There are some drugs called teratogen drugs that must be avoided during pregnancy. Tetracycline is an antibiotic and is an example that may cause permanent tooth discoloration and some other abnormalities and must be avoided during pregnancy and breastfeeding. There are 2 major topics related to therapeutic strategies in pregnancy. First, classification of dental treatments, and 2, timing of dental treatments. In the first item, we should know emergency treatment must be performed regardless of pregnancy stage, and elective dental treatment is best to be avoided until labor. But if you need an elective treatment, it can be performed in second trimester. I can see some red lines. I don't shape them. I don't know where they come from.
Scratching for you, doctor. I think your hand is, you're scratching some of the keywords.
No, I'm moving, but I don't know who has.
I guess, yeah, scratching where you're moving.
Okay, continue. I don't know. Do you want to?
Please go on, doctor. Yes, you can continue. ادامه بدین. خودتون دارین با دستتون کش میکشین. One or nothing. مشکلی نیست، ادامه بدین. It's okay.
Okay. There are some tips dentists must consider about pregnant women. First, oral hygiene instructions must be emphasized, and most attempts must be toward plaque control. Scaling and polishing and curettage may be performed, and best time of scaling is 6 months before pregnancy, when best results appear. Morning appointments should be avoided because of morning sickness, and appointments must be short. Intermission in the middle of a sitting could be of great help because a pregnant woman may experience discomfort remaining in a position for too long. And we must allow a pregnant woman to empty the bladder whenever necessary, especially in the last months of pregnancy. Now, let's look at some ways how a pregnant woman can prevent oral and dental problems. First, visit the dentist before planned pregnancy. Follow oral health instructions. Remember that diet is a key to prevent caries because pregnant women have craving for sugary and sour and unusual foods which may put them at increased risk of caries. They must be aware of these bad habits. And vitamins, especially vitamins B, C, and D, calcium, and phosphorus must be balanced in diet because of their benefit effects. In the case of unplanned pregnancy, visit the dentist to prevent oral and dental problems as soon as possible. Here you can see oral ulcers in a pregnant woman due to malabsorption and vitamin B deficiency. Here you see a pregnancy tumor, which is not a real tumor, is a reactive lesion due to poor oral health and also accumulation of dental plaque, which we had to excise and perform scaling in a woman in the 9th month of pregnancy. The picture here also shows a pregnancy tumor. In this film, you can see this tumor and as you see, we should excise before labor because it interferes with chewing and brushing teeth. You can see face discoloration due to pregnancy called melasma. In scientific forums, it's said that periodontal infection is related to adverse pregnancy outcomes such as preeclampsia, low birth weight, miscarriage, perinatal morbidity, and other adverse outcomes. But it's better to know evidence do not support this claim. But inflammation in any side of the body can harm the fetus. So it's better to eradicate every source of inflammation and infection. Dentists can help to stop harmful habits, for example, smoking and alcohol. Even after a single consumption of alcohol, a syndrome called the fetal alcohol syndrome may develop and which may cause brain damage, face and head abnormality, hearing problems, speech disorder, and growth disorder for the fetus. And dentists can help women to cease these habits. In the case of vomiting and gag reflex, sometimes some lesions may appear in the teeth because of acidic erosion. For this problem, a pregnant woman can use homemade mouthwash using baking soda and delay toothbrushing until 30 minutes after vomiting because if brushed in this period, enamel may be removed by brushing. Also, using fluoride varnish or mouthwash is helpful. Another concern is about toothbrushing in a woman which have a very severe nausea. There are some tips that can help the woman to use brush. First, use a small soft head toothbrush. Go slowly, take your time, close your eyes, listen to the music, and if the taste of the toothpaste is not good for you, choose another product and use brush without toothpaste. There are some facts and myths about oral problems and pregnancy. First, please do not attribute just any changes to pregnancy. Some changes are serious and life-threatening. I have to share a dramatic experience here about a grandma speculation. Here you see a woman